Susan is a 65-year-old female who has had a stroke. This is her first occupational therapy visit since having the stroke 2 days ago. Today she's accompanied by her daughter, Sally. The OT will assess the effects of her stroke through various motor, sensory, and cognitive tests.
Hello. Good morning, Susan. Did you say that? No, Mom, that was a therapist. Let's turn so you can see her better. Hi, Susan.
Hello.
My name is Brenda, and I'm from Occupational Therapy.
Nice to meet you.
It's nice to meet you. Have you heard of Occupational Therapy?
No.
Okay, so in Occupational Therapy, we help you get back to the things that you love and enjoy doing. Does that sound okay?
Yes.
Is it okay if your daughter stays in the room with us?
Yes.
Alright, so we're going to go ahead and get started.
Okay.
First, the therapist will start by testing the patient's attention. Some kinds of strokes result in impaired attention, memory, and judgment. Patients have trouble with task completion and lose focus easily. Susan's symptoms include right gaze preference, left side hemi-neglect, short attention span, and impaired vision. Notice that the patient's voice is very monotone and flat.
Okay, Susan, so we're going to start by testing your attention. Could you tell me the months of the year going forward, starting with January?
January. February. March.
What comes after March?
April. May. Nice pudding.
What
Did
month
you
comes
bring
in?
it though?
We're going to go get it after. What month comes after May?
June. July. August.
And then?
September. October.
What's next?
Why are we here?
We're doing therapy, Mom. What month comes after October?
October is Halloween. November. December.
Good job. Now, could you say them backwards, starting with December?
December. November. October. September.
Do you remember any else?
No.
No?
I don't.
Would you like to stop there?
Yeah.
Okay.
This type of stroke results in distortion of perceived space and profound left side hemi-neglect. Here, the therapist will test the patient's hemi-neglect by having her complete a drawing task. Due to the patient's left side neglect, she will be able to fill in the numbers on the right hand of the clock, but will fail to fill in any on the left side.
Okay, Susan, so here we're going to draw a clock, and you're going to fill in the numbers for me starting at the top.
Which one do I start?
You can start with any number.
I'm kind of hungry.
We'll get food after, Mom. Let's finish this activity. What's after 4? Okay, thank you.
The patient's right gaze preference will be tested. As you can see, the patient's gaze is fixated to the right. After this stroke, damage is caused to the right hemisphere's cortical areas, which are responsible for driving the eyes to the left. Partial blindness can also occur. This will be tested by looking for visual extinction. As seen, the patient is able to determine how many fingers the therapist has on her right side, the therapist's left hand, but not on her left side, the therapist's right hand.
Okay, Susan, I'm going to ask you to look right here straight at my nose. I'm going to hold up fingers on both sides, and you're going to tell me how many fingers you see on either side. Ready?
2,
Okay.
1,
Good.
5.
And do you see anything on your left-hand side?
No.
Okay.
Next, the patient's sensations will be tested. Patients recovering from strokes can have difficulty in knowing where the touch came from or having difficulty sensing the touch. In this specific stroke, patients can have hemianesthesia, a loss of sensation on one side of the body. In this first test, the therapist will test tactile extinction. In the second test, the pinprick test will be done.
Okay, Susan, for this next test, I'm going to ask you to close your eyes, and then you're going to tell me where you feel that I'm touching you. Are you ready? Okay, so go ahead and close your eyes now. Thank you.
My right arm. My right leg. My right hand or wrist. My right thumb.
Okay, thank you. You can open your eyes now. All right, and for this next test, what we're going to do,
Are we almost done?
we're almost done.
Did I get my goodie?
Yeah, when we're all done. This is the last test, I promise.
Okay.
Okay, ready? So we have this pencil, and we have a sharp side and a dull side. Can I show you how it feels?
Mm-hmm.
All right, so what do you feel?
Sharp,
Mm-hmm.
dull.
Okay, so for this next test, I'm going to have to ask you to close your eyes, and then you're going to tell me which side you're feeling, and I'll do it on both hands.
Okay.
Okay, ready? All right, start with this hand.
Sharp. Sharp. Dull. Sharp.
Okay, very good. Now I'm going to grab your other hand.
Are you doing it soon?
Do you feel anything there?
Hmm.
Okay, thank you, Susan. You can go ahead and open your eyes now. So we are all done for today.
Okay. We can go get pudding.
Yeah, we can now. Say bye to the therapist.
Goodbye.
Bye, Susan. It was so nice meeting you, and I'll see you again tomorrow, okay?
Okay.
All right, bye-bye.
Bye.